Hello, everyone. My name is Jim Seberg. I'm the Assistant Director for the Medical Cannabis Research Center at Drexel University. Today, we're pleased to have Dasheeda Dawson here with us to talk about the Cannabis Health Equity Movement. Dasheeda has been an absolutely great advocate for cannabis. She has served as the Portland Cannabis Manager and has now been tapped for the historic role of the New York City Cannabis Director role. It's been great getting to know Dasheeda and her advocacy, her work, and kind of bringing together the intersection of business, science, regulation, public health, as well as justice as kind of an overarching force throughout the cannabis movement. So without further ado, I'm going to pass it over to Dasheeda. Thank you so much for joining us today and looking forward to your presentation.
Unmute. Okay. Hello. Can you hear me now? Perfect. And can you see my screen as well? Awesome. All right. I just lost it for a second. So it's like, I want to make sure you all can see it. It is a Make-ish Happen Monday. So we are going to move through about 25 slides and then, of course, have time for what I love, which is Ask Me Anything kind of Q&A. Really going to be focused again on the Cannabis Health Equity Movement, which is really a coalition movement across science, business, and justice. My time in the industry has been quite significant over the last 7 years almost. I started as an advocate in New York and as a patient, ultimately that couldn't qualify for the program in New York, and eventually moved out west where I was joined by the remainder of my family, my aunt in particular, who is a baby boomer who loves to talk about the importance of cannabis in her life as medicine. Overall, I saw the need to continue to educate myself, and then eventually started talking about what I felt were gaps in the competency around cannabis science, as well as the competency on the history and the justice components, and then eventually wrote a book. And that book became an Amazon bestseller fairly quickly. This is My Road to New York City. I also have a podcast that I share with my sister that we've done now over 100 episodes and 6 seasons. And even though we are a bit on a break since I transitioned into the New York market, we will be coming back, and I'm excited because in New York, that means we can do it live. But before joining the New York team as the lead regulator for the city here, I was the lead regulator in the city of Portland in Oregon for 2.5 years. And so it's been quite an interesting journey. I never expected to be on the government side of things, but here I am on the government side of things. And it has really been eye-opening about what people can do, individuals can do as they are trying to navigate for themselves in the space. And so I talk about it a lot. And one of the biggest things that I'm constantly talking about is how we can be cannabis health equity agents, which is a term that we'll learn about as we go through today. So true to a normal kind of lecture format, even though, again, it's only 25 slides, these are the learning objectives for today's presentation. One, I really want us to understand the historical impact of cannabis prohibition juxtaposed to what we currently have as the regulatory landscape. A lot of what our regulations are is a direct result of where we've been. We'll introduce new terms. I like us all to be talking about things in the same way. And what I realize as a leader in the industry and a thought leader in the industry, sometimes you have to redefine or define terms so everybody knows what you're talking about. We'll talk about the pillars of health equity, the CHEM pillars of health equity, which is a rubric that was developed by Dr. Rachel Knox, who is one of the, I guess I would say, top docs in the industry. Certainly was my doctor for a bit and helped change my life in terms of my understanding of the endocannabinoid system, herself and her whole family. But then also the Cannabis Health Equity Movement and how we're all working in coalition across science, justice, and business in order to achieve health equity using cannabis as a tool. Lastly, I have worked with the Cannabis Regulators of Color Coalition, which is a national organization of cannabis regulators that have been known to be the cannabis policy reform and equity architects in the country. Some of the top architects in the country, Shalene Title, Kat Packer, just to name a few. But We have something called an ERP approach that we'll learn about as the starting point if you want to give advocacy and testimony as a cannabis health equity agent yourself. So let's start with some basics, really the problem. We know that the problem is actually the U.S. cannabis policy. It has been a problem for some time. We recognize from just, again, learning the history, if you haven't already gotten a chance to see Dr. Rachel's history of cannabis, where we really lay out the proof and the receipts of how cannabis policy over the last 50 to 100 years has been really preventing us from seeing the true benefit of cannabis as medicine and to our overall health equity. And I often point out the Schaefer report because it was a report that was commissioned by then President Nixon to essentially prove what he already had established, which was in his mind, he wanted to create a global policy, anti-drug policy, specifically utilizing cannabis. But the Schaefer report actually proved the opposite. It was a commissioned group of primarily doctors and public health specialists, and they, at that time in the 1970s, 1969, 1970, really didn't see a reason for why cannabis should be illegal. But he ignored the report and still decided to make cannabis illegal. And really from the 1970 period, we start to see this quote unquote war on drugs start to roll out. So that means we got to get into some new terms. When I say war on drugs, sometimes people are thinking about, I guess, crack epidemic, which we kind of proven wasn't quite an epidemic. It was a little bit of media really hyping up numbers, even though I grew up in that era, and I definitely understand the devastation. The majority of arrests in terms of drugs were all marijuana related or cannabis related. And so for Cannabis Health Equity Movement, we define the war on drugs as the over enforcement of cannabis prohibition that disproportionately continue to impact Black, Indigenous, and Latinx communities. In places where legalization has happened, it has seen some improvement, but by and large, where legalization is still not even in discussion or maybe on the horizon, we're still seeing a disproportionate impact to those communities in the criminalization of cannabis. The legacy market is another term that we've heard thrown around a lot. I'm definitely one of the, I think, individuals that started utilizing it in terms of trying to find another way to talk about what I was hearing spoken about all the time, which was the Black market. And so often referred to as the Black market when you're hearing from maybe legislators or other policymakers. But in an effort to, again, learn from our mistakes of the past, we started to try to find another definition to describe a previously existing supply and demand of an unregulated cannabis industry. It's your plug, it's the underground, it's wherever you're thinking that most people have been getting cannabis all of these decades before we started to legalize. And it's a supply and a demand. That means we have a lot of consumers in the legacy market as well, and the community supported by that economy, which means, again, I like to use words that we know. It is a real economy, even if it's not regulated. And we haven't often in government actually dealt with it like a real economy. We've dealt with it primarily as all criminals and nothing more, whether you're the supply side or the demand side. And then adult use legalization is another term. In New York, we actually do not have quote unquote recreational as a term used in any of the statute. And this was something I fought for because in the other mature markets that have already legalized for 21 and over, the top 3 reasons people shop the adult use market are for medicinal reasons, sleep, pain, and anxiety. And so pigeonholing it by calling it recreational, it in some ways, one, there's still stigma attached to it, but also we found that that's actually not the majority of the reason why people are shopping. Most people are still going in for medical reasons, but it allows you to say, hey, I'm 21 and over, and so I get to use cannabis personally, however I choose to, for self-care, medicinally, spiritually, or recreationally. But we've found that a lot of people, especially mainstream media are still kind of honing in on the recreation term. And so New York set a precedent by not including that at all in the bill. So now when we look at the history of the criminalization of cannabis, we often say a history ignored is a legacy denied. Again, feeding into this terminology that this legacy market has been in existence, and in some ways it's been denied thus far. I would say prior to 2020, it hasn't been included at all in the cannabis legalization movement. Well, when we look at the history of the war on drugs and what actually happened with policing and over enforcing, we saw a breakdown in the family and individual, in community, in wealth, and in health. And so when we think about from the individual or the family perspective, it disrupted the nuclear family. For example, we just released data in New York that 90% of the arrests in New York between the 1975 range to 1995 range, 90% were men. That if you think of a mom and a dad in the traditional sense, and now we have more non-traditional families, but if you think about the traditional sense in that time period, it was a disruption of the nuclear family to pull men out of the households. And it perpetuated recidivism. So oftentimes people would get in their first charge, probably with possession, a small low-level possession. But then, I know again from my experience growing up in New York, and I spent some time as well in Philadelphia, 8 years lived there. Once you're in, sometimes it's very, very easy for you to go back and you learn certain skills inside prison that often, translate to what your activities are outside, and then you kind of create this cycle that's never ending, the prison pipeline cycle. From a community perspective, we saw overwhelming numbers now that we have data. The ACLU is a great resource for this data, where disenfranchised communities of color were disproportionately harmed from the policing aspect. Some would say it was racially biased in its enforcement just by the sheer numbers, considering that people of all colors and types use cannabis at the same rates. But because there was over policing going on in these communities, it also justified depleting the resources in those communities as well. And so you have families broken up, communities disinvested, and then ultimately an inability to really have wealth generating in these communities and families. So it helps sustain poverty, stunted wealth building, and then limited job opportunities, because if you come out of jail or prison and you have a record, then you're having a difficult time actually being able to own a home, maybe rent a home, or get a job. Lastly, on the health component, we definitely realize that time spent in prison impacts the community when people are in reentry. And so it in some ways perpetuated some mental health issues within communities disproportionately impacted. But also now that we have I believe 38 states and more, if you think about CBD alone, but we have many, many states, the majority of the country has figured out that cannabis has some medicinal value. Well, many patients of color are fearful of using cannabis as medicine. And so it's continuing to perpetuate, the inability to use cannabis as medicine, and which in my opinion is keeping a lot of communities from being able to see that healing that they deserve. So prohibition, in short, divested communities of their access to full health, well-being, and prosperity by way of how it rolled out. And again, I'm always recommending that if anything I'm doing here sparks an inquiry, you should definitely check out the CHEM History of Cannabis lecture. It's very well done, and it's very detailed and takes you all the way through from Harry Anslinger in the 1930s all the way up to present time. But it's also impacted our way that we regulate cannabis. The first thing I'll say is, and me coming from big companies like Target, multi-billion-dollar companies, that a lot of the regulations and the government entities are confusing millions for billions. And it's definitely impacting the way we regulate. The average or mean of revenue as of I think it's a 2021 report, it's about 3.8 million. But if you know right skewed, left skewed in economics, again, if you've taken that type of class, you'll know that if you have a mean that is so far ahead of the median, that there's clearly some big companies that are skewing it, but reality is the majority of companies are all around the median, and the median is around 270K. So in fact, we don't really have what we call big business yet happening in cannabis. Cannabis gets treated like a big business, but it's still small. More than 75% actually have less than 2 million in revenue. And then because of the 280E issue, the effective tax rate is 70% versus 20% for typical small business. I also, people hear millions and they often will still think that's a big company or a big business. So I think it's important to look at comparable small business administration or SBA caps. And for small businesses, typically they're about 4 times or more in the comparable businesses. So agriculture is $8 million as the cap for you to be a small business. And retail, where we often think cannabis is really done at the dispensary, $16 million annually is what is considered the cap for a small business. So we're nowhere near that when we think about even 3.8 million as the mean. The legal market is also trending opposite to the legacy market. So right now, if you just wanted to, start selling weed, and I use that real like basic blank like that on purpose, it's kind of easy. It's not a very difficult thing. Now, certainly there's some risk to it, but it actually isn't a very difficult thing to just start selling weed. However, if you wanted to have a licensed business in the industry, there's a huge barrier of entry depending on what state you're in. And even when you haven't yet gotten to adult use, is even higher for the medical programs. There's also a lack of diversity in the legal market, typically in product and in operators, versus, again, if you look at the unregulated market, you're going to see way more diversity, way more culture, multiple cultures across various different types, across the regions. I mean, even in New York, I jokingly say that it's not the same buying weed in Brooklyn as it is in the Bronx. There's a real difference in borough diversity as well, where you're not necessarily seeing that in the legal space. And then lastly, big cannabis, or what we consider to be big cannabis, is actually a lot smaller than other big industry players. So Curaleaf is known to be one of the largest cannabis companies in the world, tracking at just over $1 billion in sales, versus like J&J is 50 billion versus Amazon is 400 billion. And so I think it's just important for us to realize that right now, these companies are being treated like they are Amazon and J&J, or I would say not even, because technically Amazon and J&J probably not paying as much in taxes, but but the truth is they're being treated like they have that type of P&L, and they don't. Not only from the top line, but also from what they can actually take out from their taxes due to 280E. Now, also, because of the way we scheduled Delta-9 THC, or tetrahydrocannabinol, we are really focused, almost hyper-focused to a detriment on current and our past laws really on these 2 cannabinoids, THC and CBD. And so the government is erroneously regulating the molecule versus the whole plant. And now that we know about Delta-8 THC as well, what we learn is really we're not just regulating the molecule, we're regulating an isomer of a molecule, one that there are many isomers of THC actually that exist, with Delta-8 being the most prevalent that we talk about outside of Delta-9 now. THC is also the marker for determining the difference between hemp and marijuana, which is a man-made designation. It isn't a scientific designation in any way. And having less than 0.3% is what designates something as hemp. Now, what I think is interesting is that people ask, is that on the whole product after manufactured? Is that just on the flower? And I would say it depends on the regulator and it depends on the state. But that is your number, 0.3%. And I think the World Health Organization actually has it at 0.2%. And then there's some other things that I will point out with CBD, for example. Right now, it's largely being derived from the hemp side of things. However, CBD can then be converted into synthetic cannabinoids that we now are seeing in our quote unquote CBD stores, unregulated. So we have a lot of work to do right now in terms of understanding the whole plant. We also like to say that CBD is not psychoactive, and that's actually incorrect. All of the cannabinoids are psychoactive by definition. They may not be euphoric or intoxicating, but they are psychoactive in that they do work on the nervous system. And as we all know right now, there are no legal limits on CBD. You can have it as high as you want, you can have as much as you want, but we're also seeing over time that there might be some detriment in unchecked CBD and unchecked CBD isolate that can be transitioned into Delta 8, HHO, and all the other synthetic cannabinoids out there as well. So that leads us to what we have right now, which is a very trifurcated regulatory scheme. We have 3 ways of regulating cannabis depending on where you live, and sometimes it's truly 3. Like in Oregon, it was almost like the medical cannabis program went away, and hemp was under the Department of Ag, and then adult use was under the Oregon Liquor Commission. And in New York, again, a precedent setting was to put all of them together. But it's just important that I kind of call out that right now on a more global level, the United States is regulating at least in a bifurcated where you have hemp and marijuana, but it's mostly hemp, medical, and then adult use all separated. And I highlight here just some of the differences. We already talked about the 0.3%, but I will say right now hemp is very much a very easy, low barrier of entry comparatively because of it being federally legal as of 2018, and the ability to get federal grants for research is actually there. And it is a pathway that I say that we're not necessarily focused as much on, and we should be, because there's still a lot of health equity that can be driven from learning about hemp. There's a lot of analogous learning that can be applied to marijuana, and a lot of people automatically assume hemp tall stalks and only for the fiber, but when you're growing for cannabinoids like CBD, you're actually it's almost indiscernible from marijuana. But when we look at the adult use, on the flip side of it, we're seeing plus or minus means it depends on the state. Sometimes you get home grow, sometimes you'll have only vertically integrated, and other times you have something where it's more open or blocking vertical integration. We have a lot more as of 2020 to work with in terms of how it's being regulated, but I think nonetheless, the biggest challenge that we're going to have to overcome is that right now it's still very much trifurcated, and cannabis is one genus. And the cannabinoids are in effect something that should be studied and also probably regulated in total as a whole plant. So right now, I would say the biggest takeaway here is that our legalization laws and regulations have actually failed to remediate every aspect of cannabis prohibition, whether it is the divestment and the destruction of a lot of communities, particularly those of color, or whether it is us really learning the science behind cannabis and understanding the full spectrum, pun intended, of cannabis as a genus. We haven't yet traverse the errors of the past. And this is partly why the Cannabis Health Equity Movement was founded. And so we feel we have this solution, and I'm always happy to teach about it because it's something that you can do on your own. You can do and infuse in your own learning, and also in coalition with other businesses. I always like to be an advocate for coalition because at the end of the day, it just feels like you're boiling the ocean when you're working on your own. And again, this requires so many different types of skill sets across business, across science and policy, and social justice. And so it's important to bring all of those experts to the table as you're crafting advocacy and policy reform. This is a quick picture of who we are as far as CHEM is concerned. You may or may not have met some of the folks, and this is just a snapshot. Again, really founded brainchild of Dr. Rachel Knox, but we are a coalition of BIPOC innovators that consider ourselves cannabis health equity agents, if you will, like really like have a badge. We are active and pioneering that path across a lot of different sectors: medicine, law, research, regulation, and more. And our goal is to educate the next generation of cannabis leaders like yourself, to advocate on behalf of communities in general, but certainly those that have been devastated by the war on drugs, and then to demonstrate that cannabis can actually be a root solution for achieving health equity for all. So for this back half of the slides, there are a few new terms that I just want to make sure that we're all on the same page, because I'll say them. The CHEM pillars of health equity, which will be the next slide, and I'll go through it with you all. But it's actually a rubric or a tool that measures the assuredness of access to total health equity, examined through the determinants of well-being: economic, environmental, human, and social. It's something that we've been working on for a while, and it is something that's been applied in other jurisdictions or in jurisdictions. So for example, the city of Portland applied it to its cannabis policy oversight team's report. We will absolutely be bringing this concept and this rubric to New York City as well. And I do think it's something, again, that works both on the government side, but also in business and community in determining, am I actually building something that's going to be impactful? Cannabis health equity is the assuredness that cannabis policies and the regulation actually leverage the economy, taxation, research, and utility of cannabis in all forms. That's why I kind of keep saying, hey, one genus, to achieve health equity. And then lastly, to be an agent is really any person or entity, public or private, which means a government agency can be an agent as well, that demonstrates good cannabis stewardship in transforming what was a weaponization of cannabis prohibition. It was weaponized against people and communities into a health equity centered acidization of cannabis legalization. It's a mouthful, but it actually is something that we've been demonstrating for some time, and very eager to get other people who are educated around cannabis and see what the potential benefits are involved as well. So this is our CHEM pillars of health equity, and where we say the part can never be well unless the whole is well. And of course, a lot of people, and you have probably heard social equity. I will start by saying that we've taken an attempt in defining things because we want to make sure that we're saying the same things and we're talking about the same things when we go from federal to state to local. But also we recognize that social equity, and actually the CHEM pillars of health equity, is not only about cannabis, it's actually ubiquitous. It's something that can be applied pretty much in any area that you can think of. But in particular, we like to apply it utilizing the cannabis legalization frameworks that we're building, just to determine whether or not we're actually doing what we're supposed to be doing. The sum of these parts is what makes the total health equity that we're goaling for. Oftentimes, and Dr. Rachel pointed this out, being a traditional medical doctor, that we think of health equity as equity in healthcare. And that actually is only a very small part of the human equity component, where we are very much focused on the physical, mental, and spiritual fitness that you receive by way of our healthcare system. But when we think of health equity, we're just thinking a lot broader. We're thinking about a balance of social, economic, environmental, and human, whereby social equity is actually a vehicle and health equity is the destination. The one thing I will call out with social equity, because I work on the government side, is that I'll be frank, I don't think that I can really point to a time in America's history where we've actually demonstrated this, which is why maybe we don't know how to define it yet, right? And why there's so many different approaches to it, because we haven't quite seen an assuredness of fairness in policy, regulation, and in the distribution of resources and services to ensure that policy and societal infrastructures, number one, assure that economic, environmental, and human equity actually exists, demonstrate cultural respect and preservation, and three, facilitate the social belonging, cooperation, cohesion, trust, participation, protection, and productivity of all people. I think we know that we haven't done that by our way of our history. And what we're hoping to do is turn that around and be, again, more inclusive. But it does start with understanding that social equity is really about how are we being fair across policy, regulation, and the distribution of all of the resources that we have in order to ensure that we get economic equity, environmental, and human for everyone. And so whenever I'm thinking about myself as an agent, and again, we'll go through a specific framework that you can use as you're doing advocacy, but this being a broader framework, it's like, it's a lot, but there are very much little ways that you can pull things out of the definition to say, okay, I can't do everything, but I can do just this part. I can facilitate social belonging through participation, right? Or through protection. I can demonstrate cultural respect. So there are things that we can actually do as agents. And it just, we kind of call that out as, don't think that you have to boil the ocean. And that's why you work in coalition, because maybe you're working more on the social equity component and someone else is more working on the environmental equity component. If we look at even environmental equity, I'll pause there just for a second, because I think it's important to note that Michigan, for example, still doesn't have access to clean water. We saw a similar issue in Jackson, Mississippi. These are some of the components that we look at when we are trying to determine how we're developing our framework. And the framework isn't, oh, I'm going to put cannabis into the water and that's going to make it better. But no, cannabis tax revenue may make it easier to have access to and maintain clean air, water, land, and soil. And in fact, utilizing hemp for soil remediation, we can now say not only money, but actual plant could actually do that as well. So you see that there are many layers to it. It is a broad rubric. It is something that I think can be studied and broken down. I probably could write papers on it. And my hope is that it definitely inspires people to pick out where you feel you can be most impactful as an agent, and lean into it, but also recognizing that there's a broader scope of health equity that we're hoping to achieve. So as I said, social equity is the vehicle, health equity is the destination. And in our view of this, cannabis is a core solution, which you probably, if you've heard me speak before, you've heard me say before. And then we think it's a core solution because we're starting to see that science is now having an influence on law and policy, that we have a new pipeline of educated regulators. I'm probably one of the first regulators, along with Dr. Rachel, to have a science background. A lot of regulators are prior law enforcement or lawyers that worked in policy, but she's a medical doctor and I am a molecular biologist. So of course we have a little bit more of a slightly different viewpoint coming in. And instead of just focused on THC and CBD, now we get to have discussions about the rest of the cannabinoids and the minor cannabinoids that are coming in. I would actually add flavonoids as well and terpenes, because all of the whole plant has an impact, and we just haven't really gotten a chance to study it, but it is impacting law and policy as we enter the market. The other reason why we think cannabis can be a core solution is because we don't even use 30% of the plant. So we still have about 70% of the plant that we've not figured out yet, and yet there are about 50,000 plus uses. And these uses are creating jobs and impact across the agricultural space, industrial space, where first with agriculture, we're seeing carbon sequestration, soil regeneration, in industrial textiles, building materials, affordable and greener building materials, replacing plastics and paper. And if you know the history again of how or why hemp became almost from the cash crop of the country to no longer being used, a lot of it had to do with DuPont and Hearst wanting to get into plastics and papers in the 1930s. And so now we're realizing they're not good for the environment, and hemp actually has the ability to be transformed into replacements for that. From a medical standpoint, the medicines and supplements, so this little yellow bubble actually represents the entirety of our medical cannabis and adult use cannabis and some of the cannabinoid CBD products that we're seeing in the market. So as you can tell already that the way we've been regulating is actually still only a small portion of what this plant can do. And then from a nutritional standpoint, we used to actually have cannabis as part of stock and animal feed. And I do think that, just again, from by way of my, and it's a hypothesis of my experience and knowledge as a molecular biologist, that these are the building blocks for our own endocannabinoids. And we've been depleting that by no longer having that as part of our food and animal feed. And then lastly, we layer on the fact that we know what's going on with our health equity pillars, that we can start to pull out ways in which, like I mentioned with the environmental one, if we use soil regeneration and carbon sequestration, are we impacting environmental equity? We absolutely are. So there's definitely ways to layer on the CHEM pillars of health equity with our knowledge of and uses of the cannabis plant. And there's a global impact across agricultural, industrial, medical, and nutritional uses. It is creating jobs. I spent a lot of time in data and policy and regulations, obviously, as a regulator, but the community reinvestment and revitalization and the ability to grow communities that have been harmed previously from criminalization is a big one from the tax revenue. And in states like New York, 40% of the tax revenue is intended to go back. There's public and private sector approach to it. I would say by and large, both have failed to date, and we're working to get that change. But I do think that ultimately we're going to have public-private partnership to see this done really well, and inclusive of institutions like Drexel to help build out an infrastructure that is on a foundation of education and equity, in which that we're always learning more and more about how cannabis can impact our total health equity. And so we always constantly are showing, again, how we're always overlaying the CHEM pillars of health equity in the conversation. So this is sort of a working framework where you can be in practice a cannabis health equity agent, sort of taking one particular approach. This is the ERP approach for end, repair, and prevent. But basically, if we're hoping to quote unquote end the harms of the past, these are just a list of things that as you're going in front of regulators and or legislators and looking to help with policy advocacy and testify, having experience and understanding that expungement, pardons, post-supervision relief right now is still impacted by cannabis use. People come out and they're unable to leverage cannabis as medicine or otherwise. Re-entry support is required, and it is one of those areas where I do think a good amount of investment needs to happen. It is I would say a spoken to priority often, but you don't see it in the dollars. But also clearing collateral consequences in policy. Like, I was shocked to find out in Oregon that if you use cannabis or a medical cannabis patient, you can't be an organ recipient or organ donor. That is the type of stuff, to me, that we need to start to clear it, even though we've legalized in Oregon, that didn't get changed. And so there are countless policies that represent collateral consequences, really aligned with 1970s, kind of perspective on cannabis as a drug and it being all bad and say no. And then we literally put it through every policy that we have. And then some would say that decriminalization is a good way to end it. We don't have to actually legalize. Legalize has become the capitalization, a marketization of cannabis so you can buy it. But in truth, having no criminal penalties for just being able to grow it and have it for yourself should be a goal. Right now, I would say we highlight expungement as like an absolute requirement if you're trying to be a policy advocate that's driving for higher health equity. People who have records ultimately are unable to maintain a number of aspects on the CHEM pillars of health equity, from economic to environmental to human. You can't get a student loan. It's hard to get a place to live. And oftentimes that impacts your environment as a whole. When we look at repairing the harm, we're talking about how do we take where we are present date and start to go back and fix some things. Community investment has been the #1 way of that. This is a new tax revenue, and for most states, they haven't had the ability to really say, okay, I got a whole bunch of new money and now I'm going to go back to these communities. Normally it's like robbing Peter to pay Paul, and you have a fight constantly. And so before it becomes a tax revenue on the books, it's important to like decide that that's going to be a priority, along with the fact that the most harmed communities should probably be prioritized. I've been coining this term return on equity investment, because at the end of the day, this community investment is really meant to drive health equity. And so we have to actually manage it in a separate fund. Before 2020, we actually did not see that happen fairly often. It was just dumped into the general fund, which means it gets allocated by percentages in the same way the general fund does. And what we found, which is adding insult to injury, is that it meant that the money from cannabis tax revenue was actually going back to police departments and law enforcement, the very groups that, unfortunately, due to the laws and the policy, did a lot of the damage to the communities. So that felt counterintuitive. And so it's so important, again, if we're going to repair, we actually have to put the money where our mouth is. Prioritize licensing and business incubation, as well as government accountability to the past harms, are some of the other areas. New York is one of the first governments, I'll be honest, that I've encountered that actually will say we didn't do this right. It took Colorado until George Floyd to say we didn't do this right as the first adult use state. So I think it's critical that it's okay, even if you're not the person who was in charge, to say the government could have done a better job. And maybe we've got to repair just by making that statement and not gaslighting individuals and the harm that they experience. But at the end of the day, if you're like, again, having to fight for what you need, and you don't want to give up that community investment from cannabis tax revenue, it's new revenue. It should go back to those communities, and that should be a priority. Lastly, prevent. Right now, this is the area where I feel we're the most scarce when we think about it, and you can definitely fight for more as a cannabis health equity agent, but our accountability systems to be able to measure, monitor, and report, that is not happening as much. Reporting for a long time was coming from private sector, nonprofit organizations like Marijuana Policy Project, DPA, Drug Policy Alliance, and ACLU, but now governments are requiring to do so. The Marijuana Regulation and Taxation Act in New York requires that the Office of Cannabis Management in New York does that. And so that's critical for us to be able to look at, okay, are we actually getting our return on investment? What do we have to change? What do we have to optimize? As opposed to what typically happens with government is you have like 5 years pass, a whole new administration, and you're like, oh, we did that wrong. But unfortunately, we've also now wasted a lot of time. Data sharing is a big one, and public re-education, because right now we've launched a lot of medical programs, we've launched adult use programs, and we haven't taken along the health professionals, and we haven't really educated the public on what we know. And it's still a lot of reefer madness out there that is being used to, I think, talk poorly about legalization as a movement. And that's the best way to change it. Cannabis Regulators of Color Coalition always says that representation in our policy and regulatory leadership makes a difference. I was only the third Black woman, a Black regulator in the country around cannabis to run run a city and or a state, and that is that's terrible. And the truth is that's what prevents us from being able to have some of these conversations, because we're not even aware of it because the representation is not there. And then labor agreements have been very much a new topic that's coming up, and how to prevent future harms, because the industry has been forming with a little bit of suspect employee relations, and the way I would say it. And so labor agreements is certainly one of the ways that you can help prevent. If there was anything I had to fight for and I couldn't get everything, accountability, at the very least, we'll have reports, because then that's the receipts, right? And we'll have enough data to be able to fight for more or advocate for more. My last slides, I will say, is that we have a lot of obstacles and challenges, and there's a lot of future harm that can continue based on the way we've already legalized. I think ignoring the importance of the medical program is probably the number one. There's a really big correlation between a successful adult use program and really a really good medical program. Thankfully, I'll be honest, I feel like Pennsylvania has actually done a better job than other states in the medical program, and in large part because of institutions like Drexel and the efforts to educate from a medical standpoint. We talked already about accountability, but I'll point out, we got a lot of bro science regulation. And so I spent a lot of time in my job saying that's actually not true, or that's actually not true. And so again, hoping to add more real science into our justice reform and our regulations. And then the last thing I'll say, because of public health safety, consumer rights and protections haven't necessarily been baked into the way we've been regulating. I think we use it when something happens, like a crisis or someone gets sick, but it actually shouldn't be after the fact. It probably should be before. So I'll leave you just with the last 4 things, which is step 1, you're already doing it. Educate yourself. You got to learn the history, learn the science, and just know that I learn something new about cannabis every day across all of those science, business, justice components. But that's the first step. Advocating is the next, because as soon as you learn something, educate it forward. Share the truth and don't be afraid to dismantle the stigma. I'm often quoted on being like, actually, and I know people hate that, but at the end of the day, it's so important that we at least try to do that with respect. And if you have resources, share the resource as well. Participate. Now we expect people to, participate, and everyone's running into the license area, but seed to solution is not the only area. We need ancillary, and we need health professionals. We need all of the support systems to make the industry really be as good as it possibly can be and to drive cannabis health equity. And then lastly, demonstrate where you are, you can build coalition and you can be a cannabis health equity agent. It doesn't require a lot. Again, it just starts with educate, advocate, participate, and then demonstrate. I went through that pretty fast, but I obviously still took longer than I wanted. But I did want to make sure that there was enough time for us to have some questions. There are some websites. CHEM Alliance is our 501c3, and really the way that we engage with institutions like Drexel and educate curriculum development, et cetera. But then also, if you're a health professional or a healer, the Association for Cannabis Health Equity and Medicine, or ACEM, is the other organization to check out. They have fantastic education, and it's important, I think, for you to continue to expand the resources for where you're educated. With that said, thank you so much. I'm so excited that I was able to come back to educate.
Thank you very much, Dasheeda. And if anyone has questions at this point, feel free to please put them in the chat. One that kind of came to my mind specifically is kind of, I think, starting off with kind of the things that you've learned about regulating from cannabis from Portland and kind of translating that over to New York and other emerging markets. Are there any kind of big areas, kind of piggybacking off with your presentation, that we could really learn from and take as lessons moving forward?
Well, I mean, I think the biggest thing is that there is real science that's happening here, and we've been trained to research only the negative on cannabis. The good news is that the president just signed very much an unprecedented federal bill. It's the Medical Marijuana and Cannabidiol Research Expansion Act. And this bill is going to allow for more research on the medical benefits and, not so focused on the quote unquote detriments. I would say about 95% of the research done in North America around cannabis is all about how bad it is. Other countries are also doing great research. Israel is like a minefield of research. Despite not having a full legalization themselves, they do allow their army or military to actually use cannabis as medicine, which says a lot, because every person in Israel must do a 2-year stint in the military. So it's almost like saying everybody at some point has access to be able to use cannabis as medicine. But I think that's the biggest thing, is that I'm encountering so much such a lack of cannabis competency within the government structure, even within the business structure. Most of the competency actually comes from the third part of the trifecta. So the trifecta is business, government, and community. And so I think we have to also go to the community to learn a little bit more where some of the more cutting edge research and work has been done has been really largely community driven, but oftentimes community is left out of the conversation. Most of the markets have been built on what the government thinks is best, which is usually very limited and very overregulated, or what business thinks is best, which is usually still limited, not as overregulated, but limited access nonetheless, and not so much what the community needs.
Yeah, and that actually kind of leads me into another question that I have about, I remember seeing kind of ACHEM's statement about leaving the US Cannabis Council and kind of divesting from kind of these really bigger companies that tend to be either kind of backed by the alcohol, tobacco industry, that they don't always kind of hold up to their promise of social equity. And then as well with kind of New York having a very robust legacy market. I remember I lived in Midtown Manhattan for a while, and just the amount of options available to you, the delivery services, and this was probably 5-10 years ago, of just understanding how complex it is. Do you have any recommendations for both kind of bigger companies or even regulators to help incorporate the legacy market into the regulated market? And then as well, kind of holding those kind of larger corporations to account to social equity?
Well, I mean, it's and I say this with my team of 2, right, that I started 3 months ago. It is often the government trying to play catch up to what's already being established in the community and or in the business sector. I would put the legacy market right now under community because it isn't, it isn't quite legitimate business yet, although these are business owners, the operators are. But a lot of the consumers are just regular folks. And I often think that where we make a mistake is that we just pretend that it doesn't exist, because while as a government official, you don't want to be accused of doing something illegal, even though so many of us have done something illegal by shopping from the legacy market. And so I'm fairly open about being a previous legacy consumer. And the truth of the matter is that that's the first step. It's like acknowledgement of it actually existing in the market, and deciding then that you're going to create mechanisms to bring those folks to the table. I'll give props to the state of New York for one of the things they did, which was they anonymized application for a training program, meaning you could submit all of your backstory without sharing exactly who you were. And therefore you could take your previous legacy experience and apply it into this training program. And it would give them, at least the state, an avenue for them to say, hey, now you've done this plus that, now we feel like you can, go ahead and move into the license component. But I just think it's about accountability and recognition. In terms of the big companies, honestly, I've worked with so many, and a lot of times it comes down to the bottom line. And what I would also recommend with them is what I learned at Target is that maybe you should create your own foundation, your nonprofit, if you will, in your entities, to ensure that if it can't be done in the quote unquote for-profit component of the business, that there is a nonprofit component that is directly connected to the for-profit that is doing that work. Target Foundation did a lot of that. It doesn't mean that it's a bad company and it should be aligned with those principles, but that's why that rubric is so important. We've asked a lot of companies and we've taught them on the rubric to say, hey, you can hold this up to what you're doing annually, looking at your ESG strategy with this rubric. But ultimately, most industries are self-regulated. And so we really have to also put our money where our mouth is. And I think from the consumer or community standpoint is don't shop where you don't feel like you are represented and or being supported in the integration.
Great. So I have a question here from Dr. Hillary Steinberg. She is one of our pilot funding recipients here. I just pass it off to her and let her ask her question.
My dog started barking as soon as I unmuted.
always the
Hi,
way.
thank you so much for your time today. I had two streams, so whatever we have time for is fine. The first is we just got IRB approval to start a study on perception and usage in the autism community. And I think thinking about a population that's been so mistreated and maligned, and thinking from, you know, a critical disability standpoint, do you have any advice for us as we start to engage this population?
I mean, I feel like we probably need to meet one-on-one
Yeah, totally.
for this one, which I'm totally down for.
Great.
I've spoken at a few conferences, and the work that's being done is like astounding there. But to your point, it is right now very insular. It isn't being projected out. We spend a lot more on, I think, again, things that you can see and understand, as opposed to, you know, a bit more invisible in its understanding. And so I would start with I would start your focus with the groups that are solely focused on autism as well, because I often, in my experience, have found that if you are in a group that is kind of working on neurodiversity in general, it gets on the back burner. So let's definitely connect offline about that, because it's an area that's really near and dear to my heart for various reasons. We have a lot of neurodiversity in my family, and we've, I think, been at a disadvantage not being able to leverage cannabis as well as we could, because we all live in different states, and the laws are different, and there's a lot of fear. If you layer on that, people of color and women, oftentimes I feel that we get even more disenfranchised and less access to. So I don't think that's the answer to what you're saying about, but I do want to make sure that I do kind of jump on with you about your study. I know you had a second question, which I think I might be able to answer a little bit better.
Yeah. So the other thing I was thinking about is I've been on a study that was specifically in school districts in Colorado, where there's this sort of narrative that all of the tax revenue goes back to schools, but it's actually not always in impactful ways, and it's definitely not always in reparative ways. And so I wanted to, and I can explain more about that if we need more context, but I was wondering, like, what specific tax revenue mechanisms do you feel are promoting health equity rather than sort of like vague feel-good mechanisms that might exist?
The number one mechanism is just having a separate management of funds that are intentionally being reinvested that way. I do think that Colorado is an example of, we legalize and we want a good story with the revenue. And so it sounds good to say it's going back into the school districts, but it's just really general fund and whatever was already being funded. So it kind of gets lost. And so in order for me to look at return on equity investment, I actually have to be looking at a fund that is managed separately. So the number one thing I would say, if you have a cause, is asking for an allocation that can be separately managed, even if it's a small one. In Oregon, for example, we launched a $15 million cannabis equity fund because there was, again, yes, it goes 20% here and 30% here, but there was nothing to actually say, okay, where is it actually working? Because it's commingled with so many other funds. In this case, we now can track the Cannabis Equity Fund, which is really designated for a lot of housing related support. And I think because of the research that we did in Oregon, we saw that that was critical. But I think we can at least now talk to, as it starts to get dispersed and used, the return on equity investment for that fund. So I just think the mechanism is really being able to evaluate it and manage the fund separately. And oftentimes that is a big fight, but if you start small, think big, start small, act fast, that's my motto. But if you start small on on the larger revenue and say, hey, I am interested in seeing the impact of after school programs on such, you might be able to get a lot further in terms of more investment because you have proof. Right now, the biggest challenge we were having was showing the proof that it was that specific investment that actually did make those changes. I don't know if that makes sense, but yeah,
definitely. Thank you.
And actually, to that point, there was actually an article summary that we had on our website a while back, kind of the area of implementation science, of kind of figuring out which policy is actually going to be attributed to certain health outcomes and consequences. There was a study done by one of our community advisory board members, Kylie Brinson, and a professor here at Drexel, Jonathan Pirtle, who I believe is now at NYU. And they found, or they had kind of done a hypothetical scenario where if you use 70% of tax revenue to go towards, say, mental health services, kind of using that tax revenue in a reparative way, that is something that kind of moving forward. I know that New Jersey kind of has this as well. So from your perspective, how feasible is that, and kind of how can people really advocate for that, or be kind of those change makers through your experience, and any advice you may have on that?
I think it's feasible as long as the money hasn't started being spent, right? So once it's already like going to some place and it is keeping that person's salary or that unit open or what have you, it is very difficult to pull back from it. It becomes a fight against, it's our thing or that. But I think if you are doing anything innovative or new, it's so critical to be able to kind of, in any scientific study, like hold the variables, right? And at least for me, the money variable is what all it gets dumped into, what is it getting dumped into with? And to me, to have it isolated is often the easiest for me to analyze whether or not there has been an impact for every dollar spent, if you will. There's a report that Supernova put out around it's their social equity impact report, and they have their social return on investment, which is a similar type of I guess, analysis as the return on equity investment. But basically, it's, in their case, they know that they can look at the cannabis tax revenue that has been specifically allocated just to help licenses come on board and see that there has been a return on investment. So again, it is hard in government because everything is connected. And I'm literally building a framework that's so complex in this integration for New York City right now that I realize that I have to look at it in a wheel, hub, spoke kind of way. And when I take my analysis, each spoke hopefully has a money stream that allows me to say, okay, within this spoke, this was our return on investment. But the more we're able to advocate before it gets allocated, that means before the money has been decided where it's gonna go, usually the better, and a much better chance. But I definitely think a lot of governors are looking at this as a way to increase the coffers post-COVID recovery. And as a result, the fight is a little bit tense because everybody wants to have their coffers replenished. But I would say in order to do that, you've got to prove that your program or your initiatives actually have some real significant impact. And I also think we need to invest like we invest in any other, portfolio diversely. Not everything has to go into just one particular thing. If we're talking about mental health resources, what they did in Oregon was they kept putting it in the same, they allocated the same way they have every year for the last 50 years. And it just was a bump up in their revenue, as opposed to saying, hey, we're going to take half of that and put it in what we've typically done. And here's the other 50% we're going to do a new innovative approach for mental health or substance abuse services. I'll give it the last thing I'll say before we go, just an example on that. For example, we really wanted to see, I worked with Native American tribes on utilizing cannabis to support people who have various opioid addictions in their transition out. Some people like to say cannabis is a gateway drug, and we kind of started saying it was the gateway out of drug use. When working with the Native American tribe, very much has set of money because they are able to do so in the way that they're governed, or they govern themselves. But that is what's missing. I tried to take the learnings from there and apply it to Oregon. And it was like, well, all the money is already allocated and spoken for in all these old ways in which we do substance abuse. And there wasn't really room for us to figure out, well, what about new ways of kind of creating studies around cannabis, used in substance abuse or helping people with substance abuse. And I think that's the part where I'm like a little bit concerned that we have so many new ideas and approaches, but we don't actually get funding for it without fighting to take away funding from something that has been historically established. And so that's the rub, right? And so the sooner we get it ahead of it and also establish these ideas while building out the cannabis policy reform. So don't wait till you get the money. Have the idea in mind, kind of like Dr. Hillary, like have the idea in mind so that as you are advocating, you can say, and I have a study in mind, because that was what was missing in 2010 and 2011 as we started to see the first states come online.
Yeah, that's definitely kind of similar mind of what I have. Great to hear that. And I kind of think that this time, at least in my opinion, is going to be very crucial for advocates. So everyone on this call and whoever might be listening to this in the future, being an advocate right now is going to be able to have that biggest change possible to set up the industry the way that you want to see it set up. If you want to be able to have home grow, if you want to be able to see schools receive funding or additional funding, and having it allocated in areas or programs in which you are particularly passionate about. And I kind of have a feeling as well with federal legalization as well too. It is good that we wait on this and learn the lessons from individual states, do our research, make sure everything that we are doing is evidence-based, and making sure that moving forward, we let the research and regulators and community kind of work together to make sure that all those needs are met. Very thankful to have you, Dasheeda. This has been an absolutely great to hear your experience and more about the Cannabis Health Equity Movement. I know that specifically within public health, it can kind of be certainly that stigma still exists. So thank you very much for your time. Thank you all for attending and look forward to staying in touch. Feel free to check us out on our Twitter account, also Drexel MCRC on our website. We'll have this posted, and thank you all for attending.
Thank you for having me.